The stories making headlines, and we're reporting on another sickening state of affairs in the wake of the global health emergency brought about by the novel coronavirus outbreak. Now, the saying goes, when China sneezes, the world catches a cold. And this time it's of a different strain, but the Ministry of Health seems to be responding to it like a common flu, and in some instances using what seems to be rudimentary means.
For the past week, since the first suspected case of coronavirus was reported in the country, the Ministry of Health has been addressing the issue through statements, giving the impression of an ill-prepared government. Numbers have been thrown about, giving little confidence to count on. Even though Kenya Airways flights to China were cancelled, the China Southern Airlines has still been landing at the Jomo Kenyatta International Airport.
Well, one of the questions is, are we safe? And in the event of an imported case of the novel coronavirus, can we contain and control it? Well, so far, Kenya needs a more direct message, and from no less than perhaps the head of state, as is the case elsewhere in the world.
May this message get to him even in the United States, where he's at right now. In the meantime, the Ministry of Health, in yet another statement this evening, says all of the suspected cases of the coronavirus have turned out negative, even as the global death toll rose to 362. NTV's Brenda Wanga reports that Kenya and Africa is grappling with preparedness and testing protocols for the novel coronavirus strain.
Kenya has been hit by the coronavirus scare 3 times but survived. 3 passengers traveling from China on diverse dates and presenting flu-like symptoms have had samples taken and tested according to the Ministry of Health and found to be negative, an obvious relief to a country that seems ill-prepared for the virus that is spreading faster than a cure can be found.
We have not reported a death, and I pray we don't report a death. So our behavior and response will be different.
While the negative results may give the government some breathing room, concerns are now being raised about the caliber of testing taking place. Sources indicate that the lab carrying out the test in South Africa is still trying to set up a specific novel coronavirus test, but it could take as long as 2 weeks to get it up and running, which means that the tests being carried out are currently for all non-respiratory viruses and not the new novel coronavirus strand. As it stands, the disease has now affected 17,485 people across 24 countries with 362 fatalities, and the only death reported outside China happening yesterday in the Philippines.
Currently under total lockdown.
While Kenya keeps her fingers crossed that the disease will give it a wide berth, there are still concerns about the handling of the scares thus far. The World Health Organization recommends that one who is suspected of having been exposed needs to be quarantined for at least 12 days. It remains unclear if this is being observed here.
We call on all countries to implement decisions that are evidence-based and consistent. WHO stands ready to provide advice to any country that is considering which measures to take.
The fate of Kenyan students in Wuhan and China still remains tied to their host country, as Kenya maintains its stand of a non-evacuation policy. South Africa too has warned its students against attempting to leave Wuhan. Other countries, however, are evacuating their people from the epicenter of the disease outbreak, but under stringent precautions. Protective gear for both the travelers and the health and airport staff, and straight into quarantines to manage the possibilities of a spread. Meanwhile, in China, Wuhan, efforts to construct yet another mega hospital are underway as the burden of the disease and the strain on the existing facilities threatens to overwhelm the responders. Brenda Wanga, NTV.